You wake up with a pounding fever, grab medicine from the cabinet, and book a doctor's appointment online. Simple, right? Now imagine facing that exact same sickness 50,000 years ago. No pharmacies, no antibiotics, no internet search for symptoms. Just you, your small tribe, and an illness that could turn deadly within days if nothing at all was done about it. So what did early humans actually do when sickness struck their camp? The answer is far stranger, smarter, and more surprising than most people would ever guess. Archaeologists have found something shocking. Ancient human skulls with neatly drilled holes, healed over time. This surgery, called trepanation, dates back over 7,000 years. Early healers believed drilling into the skull released evil spirits or built up pressure causing pain, seizures, and madness. Remarkably, many patients survived, their bones showing clear signs of healing. Trepanation wasn't random butchery. Skulls show careful technique, steady hands, and repeated procedures on the same person, suggesting early humans understood something about anatomy long before written medicine existed. But surgery was rare. Most sickness was treated with what nature freely provided: plants, roots, bark, and instincts passed down through generations of trial, error, and careful observation. Willow bark, packed with a natural compound similar to aspirin, was chewed to ease pain and fever. Long before chemists isolated it, early humans had already discovered its healing power. Neanderthal remains found in Spain contain traces of chamomile and yarrow, plants still used today for digestion and wound care. Even our ancient cousins were practicing herbal medicine daily. Honey was another ancient miracle. Its natural antibacterial properties made it perfect for cleaning wounds, soothing sore throats, and preventing infections long before anyone understood the science behind bacteria. Some tribes packed wounds with spiderwebs, believed to help blood clot faster. Modern science later confirmed spiderweb silk does contain properties that genuinely support natural wound healing. When infection set in, some healers used something unsettling but effective: maggots. These larvae ate only dead tissue, cleaning wounds naturally and preventing deadly infections from spreading further. Broken bones weren't ignored either. Early humans splinted limbs using sticks, bark, and animal hide, allowing bones to heal straight instead of crooked, decades before modern casts existed. Even stitching wounds is ancient. Some cultures used biting soldier ants, letting their strong jaws clamp skin shut, then twisting off the body, leaving the head as a natural stitch. Sickness wasn't only treated with the body, it was treated with the mind too. Shamans and healers performed rituals, believing illness came from angry spirits or broken spiritual balance. Chanting, dancing, burning herbs, and symbolic ceremonies weren't just superstition. They created comfort, reduced stress, and strengthened community bonds, factors we now know genuinely support physical recovery. Early humans also understood something surprisingly modern: contagion. Archaeological evidence suggests sick individuals were sometimes isolated from the group to prevent illness from spreading to healthy tribe members. Entire camps would occasionally relocate away from areas linked to sickness, unknowingly practicing an early form of quarantine long before anyone understood germs, viruses, or bacteria even existed. Diet mattered too. Sick individuals were often given specific foods: broths, fats, and easily digestible meats, while others were avoided, an instinctive form of nutritional care. Rest was respected as medicine. Healthy tribe members would hunt, gather, and guard the camp, allowing sick members to recover without the physical demands of daily survival duties. Steam therapy existed too. Heated stones dropped into water created steam used to clear congested lungs, soothe sore muscles, and treat respiratory illness, an ancient precursor to modern saunas. Animal fat mixed with ash or herbs formed early ointments applied to skin infections, burns, and rashes. Greasy, strange-smelling, yet surprisingly effective at protecting healing wounds from bacteria. Toothaches were agonizing without dentistry. Evidence shows early humans pulled decayed teeth using primitive tools, sometimes packing the socket with beeswax to numb pain and seal the wound. Community care mattered enormously. Fossil evidence shows severely disabled individuals who survived for years, meaning others fed, cleaned, and cared for them. Early proof of human compassion in action. Elders held enormous value as living medical libraries. They remembered which plants healed, which poisoned, and which seasons brought sickness, passing critical survival knowledge down through spoken storytelling. Of course, not everything worked. Many remedies failed, superstitions caused harm, and countless people died from illnesses we now cure with a simple prescription and pharmacy visit. But every failure taught something. Trial and error, generation after generation, slowly built the foundation for what would eventually become modern medicine, surgery, and pharmaceutical science today. That willow bark chewed around a campfire eventually led to aspirin. Those maggot-cleaned wounds inspired modern wound debridement therapy still used carefully in hospitals for treating stubborn, infected injuries. Even isolating the sick, something early humans did instinctively, became the scientific backbone of quarantine protocols used worldwide during modern pandemics, including the recent global health crisis. Next time you take medicine for a headache, remember, someone tens of thousands of years earlier was chewing bark beside a fire trying to solve the exact same problem. Early humans had no laboratories, no microscopes, and no medical degrees, yet through pure observation and desperate necessity, they built humanity's very first healthcare system, piece by fragile piece. Every bandage, every pill, every hospital visit today traces its roots back to someone kneeling beside a sick friend around a fire, desperately trying anything that might possibly help. Medicine didn't begin in a laboratory. It began in caves, campsites, and small huddled communities where survival depended entirely on caring for one another through sickness and injury. So the next time you feel sick, remember you're carrying an ancient legacy. Thousands of years of human curiosity, care, and resilience against disease and suffering. Our ancestors didn't have antibiotics, but they had something equally powerful: relentless curiosity, deep community bonds, and the refusal to simply give up when facing sickness and pain. That same instinct still drives medicine today. Scientists in labs, doctors in hospitals, all continuing what started around a fire tens of thousands of years earlier. History isn't just about kings and wars. Sometimes it's about a sick person, a worried tribe, and the desperate creativity that eventually became modern healthcare as we know it. So, next time you take a simple pill for your headache, remember, you're benefiting from tens of thousands of years of trial, error, and human survival instinct.